lab test will look at total testosterone, free testosterone, and DHEA. So if you get a lab test done and maybe you're with your primary care doctor or you get your labs done through me, typically for a male and total testosterone, we're looking for a level that's above 300. Typically below 300, we would consider that low testosterone. Hey guys, Dr. Will here from Miami Spine and Performance. Today I want to talk to you a little bit about men's health. So as you guys know, last year I started working with patients in functional medicine. A lot of the patients that I see for functional medicine were focused on gut health, microbiome, adrenal gland, thyroid issues, and other things like that, blood sugar control. But one of the areas that I've also been working with patients on, and sometimes co-collaborating with the patient's medical doctor, endocrinologist, or OBGYN, is on men's and women's hormones. So I'm going to do a little series on men's and women's hormone optimization to educate you guys a little bit about what are the things that you should be looking for if potentially your hormones are off, what are some of the risk factors, and then what are some of the conservative options if maybe you're not ready to go on a medication or you're not ready for hormone replacement. Of course, you should always consult your physician on these things, but I want to give you guys some ideas of what the other options that are out there. So for men's health, the primary issue that men deal with, and this is, on average, it starts around age 30 and it kind of each decade gets a little bit worse, which is low testosterone. Now I've seen men in their mid-20s that have clinically low testosterone as well. And so typically what we'll do is we'll do a lab test. We'll look at total testosterone, free testosterone, and DHEA. So if you get a lab test done and maybe you're with your primary care doctor or you get your labs done through me, typically for a male and total testosterone, we're looking for a level that's above 300. Typically below 300, we would consider that low testosterone. Now that varies per age. So for example, if you're in your late 50s, that may be more normal, but certainly if you're in your 30s, below 300 is considered low. And that level ranges usually up to 1100 or so. So if your testosterone is closer to 1000, you would be at the high end of normal. And that's typically what you'll see in people that are on hormone replacement therapy, is they'll hover in that 7, 8, 900 range. So what are some of the symptoms that you might have ahead of time to know whether or not you should get your testosterone tested? So the initial group of symptoms are things like low libido, erectile dysfunction, lack of sexual appetite. So for example, you may not be turned on as often, you may have erectile dysfunction, and you may have issues like that, right? And so that's a very common thing that you'll see with low testosterone. That's usually one of the first signs that men will have. And again, if you're a man that's in your 30s and 40s and you're having these issues, specifically things like erectile dysfunction, that's not normal for that age. And so you may be having low testosterone that are causing those issues with libido. The second category of issues is going to be with mood, right? So if you have low testosterone, you may be feeling depressed, you may be anxious, you may be irritable, you may have brain fog, and different things like that. Now, of course, there's a lot of different things that can cause those symptoms. And, I understand that at times it's hard as a man to understand if you're feeling depressed because, you're going through a difficult time, or you're feeling anxious because you have a stressful thing at work, or whether or not it's an actual clinical issue that should be evaluated by a doctor. But if you're having both of those sets of symptoms, so you're having the low libido and you're noticing that your mood is deviating from normal, you may have low testosterone. The third category of symptoms that I would like to talk about are things like difficulty putting on muscle mass, difficulty with recovery from workouts. You may notice that you're holding on to body fat even though you're at a caloric deficit, you're doing your cardio, you're doing your weight training, and you're having trouble losing weight, specifically around the abdomen. You may be developing breast tissue, some gynecomastia. You may notice excessive hair loss and things like that. You may even notice changes in the voice. So all of these sort of transition to female sex characteristics or putting on excessive body fat could be a sign that you have low testosterone and or high estrogen. So I would say certainly if you have some symptoms that check each of these three boxes, so the physical symptoms, sort of libido related symptoms as well as the mood symptoms, it'd be a great idea for you to come get your testosterone checked, as well as some other factors that we look for to try to figure out why you have low testosterone, whether it's a problem with the gonads, whether it's a brain problem, whether it's a problem with your body processing cholesterol. We try to get to the bottom of the cause so that we can treat the cause rather than just as a first line of defense, just go and replace the testosterone. However, if that's an option that's enticing to you, that's generally a very safe therapy as long as it's done under the guidance of a physician. So what are some of the things that cause low testosterone? So if you're out there and you say, okay, my testosterone's at a fairly healthy level, how do I maintain that and how do I prevent early onset hypogonadism? Well, a couple of the things that would cause low testosterone would be number one, lack of sleep, right? So if you have a chronic lack of sleep, meaning that you're sleeping 4 or 5 hours per night, most nights of the week, you're having very few nights where you're getting sort of 7 or more hours, odds are that your body's going to start depleting your male sex hormones, specifically testosterone. So if you're not sleeping well, that's going to deplete your testosterone in addition to all the other types of symptoms that you're going to get with that lack of sleep. The second thing that can be causing low testosterone is if you are overweight, you're obese, you have dyslipidemia, potentially you're diabetic, potentially you have metabolic syndrome. All of those things can cause your testosterone to drop. So if you're somebody who is overweight or obese, you're carrying an excessive amount of body fat, you have high cholesterol, you have high blood sugar and things like that, those are all things that are going to lower your testosterone. So maintaining a good sleep schedule and maintaining a healthy exercise routine and body composition are going to help keep your testosterone at a healthy level. The third thing that can cause low testosterone are things like stress, as well as environmental stress. So stress in your day-to-day life, psychological stress, environmental toxins. So if you're working in a work environment where there's potentially environmental toxins, that can affect it as well as some medications, right? There's been some evidence that painkiller medications, for example, when used chronically, can lower testosterone. Lipid-lowering medications such as statins can lower testosterone. Now, I'm not saying to get off of these medications prescribed by your physician, but keep in mind that you may eventually want to try to get your cholesterol to a healthy level where you can wean off these medications or get your pain to a manageable level where you can get off the medications, because chronic use of most medications can lead to low testosterone. Okay? So there you go, guys. There are a couple of the key things that you should be looking for, maybe some things that you can change in your lifestyle to make sure your testosterone's at a healthy level. Certainly if you're a male over the age of 30, you should be getting your testosterone checked semi-regularly, annually, or every couple of years, depending on what your level's at. In the next video, we're going to talk a little bit more about conservative treatment options, and I'm going to talk to you guys a little bit about some treatment options that your medical doctor might look to prescribe for you so you can make an informed decision on your own health. Thank you guys for watching. I'll see you next time. Dr. Will.